All right, hit
All right. So, take two. Um, so I'm Julia. I am the respiratory therapist who helps to run the pulmonary rehab program at the O'Brien Community Center. Um, I am passionate and I get really excited about all things related to breathing. Um, I'm also a yoga teacher, so I've been doing yoga for a really long time, and I found this particular type of yoga called Kayut yoga, which really resonates with my body because I come from a background of a lot of sports and athletics. And as a consequence of that, I've had injuries and some stiffness and things like that. And so I realized that I didn't want my yoga practice to be an athletic type of yoga practice. I wanted it to be more restorative and healing. So this Kayut is we focus on the joints, which I think someone had mentioned, and about just like increasing space in the joint ability for movement. Um, it's not necessarily easy, but it's managed through your own awareness of your body. So, say we're in a pose and we're working on the hips, and the hips are really tight. So, you can keep it light and manage what's happening and know something's happening. Or if you feel like you can go for a little bit more, then you can go forward and things. So, I guide you through a spectrum of like modifications and ranges. So, most of the people who are drawn to this yoga may have a history with pain, or they're just really stiff, or sometimes they're hypermobile and they're looking to regain more stability in their body. It's generally more relaxing, and we do it on the floor. But it can be modified to be done in a chair. So that's
it.
Thursdays, 4 to 5 at the O'Brien Community Center. And just like Rebecca's classes, it's a donation-based class, and you can sign up through a registration link, which she can share with you all. Um, so onto the breathing. So I I'm going to give you this talk about breathing, and I know this is like a mixed audience, but I'm going to assume that most of you are here because you know Rebecca and you're probably into exercise or into taking care of yourself. So I will kind of gear it more towards that exercise piece and how breathing can help with that. I work with the pulmonary population, so these are people who are learning how to manage shortness of breath. And in some ways, we all manage shortness of breath when we exercise, when we do things at more intense levels. So you'll hear me talk about that, like, if you get short of breath, that sort of approach. But anyway, let me share my PowerPoint. Um, oops, try this again. Okay, let me go to present.
Awesome.
Okay, can you guys see? It should say how we breathe matters.
Yeah.
Okay, great. Okay, so to start, hold on. All right, so I have a promotion. I'm going to sell you something. So this is a device that you're really going to want. You're going to want for yourself, and if you are a provider, you're going to want it for your patients. Um, This device has a 1888 number. So call today, 1888 breathe. But basically, this device can help to reduce blood pressure. This device can help with engaging the diaphragm, so a primary respiratory muscle for breathing. Some of my favorite things about this device is that it actually protects the lungs. So it filters air. It helps with humidification of our breathing. Um, it helps to warm the air we breathe. It can help to lower heart rate. It can promote relaxation. Um, improves sleep. That's another big thing that I like about this device. So you're really going to want it. And then just because, you are all here today, I'm going to throw in some free shipping for you. And in fact, this device is it's on your face. So anyone want to guess? It's your nose. Um, so I start with talking about nasal breathing because if you listen to my whole presentation and you're like, "Woo, that was way over my head," or whatever, you don't remember anything, I would hope that you remember the part about the importance of nasal breathing. It really is how we are, as humans, designed to breathe. I'll talk about mouth breathing as well, but sitting quietly at rest, breathing in and out of your nose is how you should breathe. And this is something that many people don't think about, right? I ask everyone who comes to pulmonary rehab, are you a nose or a mouth breather? And most of the time I get, I don't know, I never paid attention. Or if they think about it, they're like, well, yeah, I actually think I'm a mouth breather. Um, so I'll go over like education around more benefits of nasal breathing, but that is actually the best way to breathe. So I'm going to talk about the science of breathing. So, as I mentioned, I'm a yoga teacher and I did lots of yoga trainings. And so there's this whole like, no pun intended, but breadth of knowledge around yoga and breathing. And I think it's very, very beneficial. But when we get into like the medical realm, sometimes it's just not fully understood. And we can look at it through basically three pillars. So one is as it relates to biomechanics of breathing. So biomechanics is like, how does my chest wall move when I breathe? Am I using my diaphragm? Is there something that's limiting my breath? Like maybe there is a pulmonary condition and I don't breathe as well. Biomechanics is nasal breathing because it helps to get the air down deep into your lungs. And that's kind of what we do with exercise and yoga and stretching and all these things. So I'll cover that primarily. I'll touch a little bit on the biochemistry. That's where it gets super nerdy because we're actually looking at the molecules inside. So we're looking at oxygen, we're looking at carbon dioxide, and another gas called nitric oxide. And then you really can't talk about breathing without talking about how our nervous system responds. So it's kind of like this two-way street. So if I'm super stressed out about something and I'm upset, my breathing is going to follow the pattern of that emotion of being upset. So it's kind of like a superpower because we can also use the breathing to send signals to our brain that everything is chill and good. So a lot of like the yoga practices that I've studied use like diaphragmatic breathing because we're trying to achieve more of a state of calm. If you've ever had someone say, okay, slow down and take a deep breath, or, try and count your breathing, they're trying to elicit that relaxation response from your breathing to your brain. So it's pretty amazing how much it's connected. So we say the psychophysiology. And then we're going to practice. We're going to do some simple breathing practices, and then I'll go over some breathing resources. Okay, so back to nasal breathing. So I mean, it's kind of small font, but there's so many benefits to nasal breathing. Um, it I'm not an expert in the ear, but it promotes ear health. It helps just with mucus clearance. It filters. Your nose kind of has this natural antiviral property, so antimicrobial. So breathing through your nose helps protect your airways and your lungs. People who are more in the dental realm can speak more to the oral health, but if you're mouth breathing, the type of bacteria that kind of grow in your mouth can affect your oral health. Just like tongue position, speaking, helps with, your throat health, helps with oxygen. to prevent infections. And then also it sends, like I was just talking about, it sends signals to your brain that everything is okay, that we're in like this kind of balanced state. Because when we start mouth breathing, it sends the opposite signal to the brain that, okay, we need to prepare for something exciting, or maybe I'm exercising and everything is kind of being upregulated or increased because I'm mouth breathing. And it can help improve sleep. That's an area that is a little bit trickier because we can't control whether we're breathing through our nose or our mouth when we're sleeping, but I'll touch on that. It prevents hyperventilation. So you've probably heard of hyperventilation when you're breathing in excess or too fast. So nasal breathing helps to slow it down. Since I mentioned that most of you are probably connected through exercise, it can help perform or increase performance in athletics and just general exercise. And then it affects like the posture of your head and your neck. So lots and lots of benefits to nasal breathing. Okay, so I touched on most of this stuff, but what I love about this picture, so this was an ex-Olympian, Sonia Richards-Ross, and she actually trained in one of the breathing methods that I did called Buteyko breathing. So she trained herself to breathe strictly through her nose while she was performing these high level, sprints and runs. And you can see in that picture just how calm and collected her face looks. Her mouth is closed, she's nasal breathing, she's running very, very fast. Versus the other two women next to her, they just look like they're suffering. Their mouth is open, their faces are kind of clenched. So overall, this type of it's training. It's almost like lifting weights. It's helped her to improve her cardiovascular system and be able to perform better. So I think about the same thing with even just like walking on a treadmill or riding a stationary bike. Can I keep my mouth closed and breathe through my nose? So improve performance. When we talk about the nose, I mentioned the other things that it filters, warms the air. If we have developed the habit of mouth breathing for a long time, sometimes the nose isn't very open, or we say patent. So one of the ways that you can test, and you're welcome to try this, it's no cost to you, is to check your nasal patency. So you take your finger and you plug one side, and you check it, and then you plug the other side. So I can tell I'm actually a little bit more open on my right side. And it's okay. Usually one side, they call it your nasal cycle. One side of your nose is always kind of self-cleaning. And so it may be a little bit more congested than the other. But if you test and you're like, there's no air moving, you may know your nasal history. Maybe you had an accident, you were hit by a football or something like that. Maybe you have that deviated septum. I would say it could be worth just going a little bit further and checking with an ENT if you haven't done so already. As far as like congestion, chronic congestion, that post-nasal drip, that would be something that either your primary care, or if you have a pulmonologist, they're experts that can help with that. Because anything that's happening up in your nose can affect your breathing because it's connected to your airways and your lungs. And then they make these, you've probably seen the breathe strips. I think they're called Breathe Right strips. There's different brands, but it's like what the football players wear, right? It's those strips that help to open up your nose. And one way you can test if these little strips would help you is you can take your fingers and place it kind of on the bridge of your nose and just breathe normal. And then just put a little pressure kind of pulling out, and just see if it helps to open up your nasal passages. So my nasal passages, as I say, are a little bit more narrow. So when I do that, I can definitely move much, much more air. So just a consideration in terms of being able to improve the quality of your breathing. Dry mouth. So if you're a mouth breather, chances are you probably have dry mouth. Especially at night. They do make products that, they say can help with that. I think Biotine is one of them. I haven't found that stuff to be super helpful, but you know, worth a try. Definitely staying hydrated can help with that as well. But training yourself to breathe through your nose. So something I'll do with my pulmonary rehab people is sometimes I just have them close their mouth and set a timer for 1 minute. And just bring that awareness like, okay, I can breathe through my nose. Because the more you mouth breathe, it's kind of like a use it or lose it sort of thing. Your nose will be like, oh, you don't really need me. So I'm going to become congested. And that's fine because you're just mouth breathing. So you want to train yourself to be able to breathe through your nose. And then if there are issues, then it's worth talking to someone about. Okay, so some of you, if you do Steps to Wellness, Pulmonary Rehab, or some of the other exercise programs, this chart might look familiar. I know we have the same colored chart around our gym. I've adapted the chart to be for breathing and using your nose as kind of a marker of exertion. So there's different exercise zones some of you may have heard of. But zone one would be like when you first start exercising and you're in just that warm up phase. RPE stands for rate of perceived exertion. So it's something that people who work in the exercise field ask that question quite a bit because we want to know how hard you're pushing yourself. So it's a 2 to 3 out of 10. So that's like your warm up, right? Nothing's too super hard. And as far as your breathing, what that would ideally look like would just be in and out of your nose, just starting your exercise. Zone two, you might be going a little bit harder. Your rate of perceived exertion might be going to a 4 or 5, and you might notice that you're breathing faster. So that's one of the first parts of breathing that will change when you start to demand more, right? So I'm using my legs, say I'm walking on a treadmill, and my legs are taking in that oxygen and they're producing that carbon dioxide, which I have to exhale. So it's the carbon dioxide that sends the signal to my brain, please breathe faster so we can get this carbon dioxide out. But it's not like super stressful yet. So you should still be able to breathe through your nose, but just maybe notice that the breathing rate is getting faster. And then zone three is where I really work hard to teach this to my patients. So it's it's kind of like a bridge between going from nasal breathing to mouth breathing. So you can start to add that pursed lip breathing. And another way I think of this is like gears on a car, right? You're gonna start in first gear, go to second, and then go to third. So you want to slowly kind of increase not only your intensity, but just paying attention to how your breath is responding to this. So nose mouth. So pursed lip breathing, if you've never heard of it, it's where you breathe in through your nose and then you blow out through pursed lips. You can probably hear my breath. It's just a slow, long exhale. And where the magic is in this breathing is the pressure at the mouth. Because your lungs are little air sacs, they're little balloons. And so when that pressure from your mouth gets down into your lungs, helps to lengthen your exhale, but it also can help to open and expand those air sacs a little bit more and allow a little bit more time for that exchange of oxygen and carbon dioxide. So don't skip over pursed lip. It's really, really helpful and important. And then you may get to the point where you're like this zone 4, mouth breathing, and then I call zone 5 is like sprint to the finish. You're not going to last much longer. Maybe you're doing an interval and it's just about to end. And then you're like, whew, okay, I got through that. And then you kind of slow it back down again. So just a little tip sheet sort of chart. This is the stuff that I think about when I'm exercising. I know I'm crazy breathing lady, but just to bring awareness to how you breathe with exercise. Okay, so the mechanics or biomechanics of breathing. So this picture just shows a lot of the respiratory muscles. The diaphragm is that main muscle that's tucked in underneath the rib cage. Our lungs sit on top, and then our organs are at the bottom. And then these intercostal muscles, they're the muscles between your rib cage. They help with breathing, and we'll talk about that. We'll do a little practice with those. And then a lot of the muscles around your neck and your shoulders actually can help with breathing as well, in addition to your abdominal muscle. So I think of the like the lungs as I call it the software, right? It's tissue. We don't have a lot of ability to change the organ itself, but what we can influence and change is, like, I call it the hardware, the skeleton and the muscles. So we'll talk a little bit more about that in just a second, but just taking that into consideration when you're stretching, when you're exercising, when you're doing yoga, what am I doing with my chest, with my shoulders, right? Are you on the treadmill like this because you're not making much space, versus thinking about being a little bit more upright so your lungs have that space? Another interesting thing is that in addition to the diaphragm, so I'll use my hands as the diaphragm, um, we have three diaphragms total. So we have our vocal cords, which are a diaphragm, and by diaphragm it means it's like a layer that separates part of the body. So you have like your thoracic, which is like your chest, and then you have your abdomen. So your vocal cords are at the top of your thoracic cavity. Then you have your diaphragm tucked in the middle, and then you have the pelvic floor, which is another diaphragm. So I mention this because they're all connected. And I have worked with people who have pelvic floor issues and breathing issues. So sometimes we can help the pelvic floor by also addressing the breathing, especially diaphragmatic breathing, because the organs are sitting in there and your diaphragm is on top of the organs. And then other mechanics, kind of just touched on this, is your posture, and your diaphragm is actually one of your muscles that helps with balance because it's one of your main core muscles. So if the diaphragm is weak or off, sometimes we can see how that can influence our balance. Just kind of interesting. The body's kind of amazing. Okay, so I've been talking for a while. I want to do a little breathing test with you guys. So it's called a high-low test. And what this is you're going to place one hand on your upper chest and then one hand on your belly. And we're just going to bring awareness to how we're breathing. So don't change your breath. But what I want you to do is to feel with your hands which hand is moving more. So you're going to do like a little analysis of your breathing. So I'm just going to be quiet, and I would say either just look down or close your eyes. So you don't need any external stimulation to do this. You don't need to look at the screen or see me. So just start and try to breathe through your nose. So just notice how you're breathing. And then just for fun, we're going to calculate like a little percentage. So what percentage of the top is moving versus what percentage of the bottom? So for me, because I'm presenting and I'm talking and I'm all excited, I think I'm about 50-50. So my lower hand is moving about 50% and my upper hand is moving about 50%. And so I can change that. So I can, with that step one, awareness, how am I breathing right now? I can say, okay, I need to calm down because I'm presenting and you guys don't want to see me freaking out up here. So I can say, all right, let's engage my diaphragm a little bit more. So the diaphragm would have the lower hand. I don't know how well you can see, but my lower hand is going to move out and in. So as I inhale, this is the diaphragm, pushes down into the organs. And then what I feel with my hand is just the organs moving. So the hand will move out and in. So that's basically diaphragmatic breathing. So considering just kind of how you're breathing, that check-in, that high-low test, and then do I want to initiate more of a relaxation response? If I'm walking on that treadmill and I got my grade cranked up, I'm probably going to be upper chest breathing. That's okay because that's just what my body is doing to keep me going. But it's just that awareness that we have that ability. Pursed lip breathing, this is just like a picture of it. It's showing that this guy's breathing in maybe for 2 seconds through his nose and then exhaling usually twice as long through that pursed lip. Bringing postural awareness to your body, especially at a computer. I can feel myself on this computer. It's like the computer's like pulling me down and I start to get all rounded. So trying to stay upright, especially with certain things. The exhale on exertion. So not everybody has to deal with shortness of breath, but if you are someone who notices, gosh, I can't get up the stairs as well anymore because I get really short of breath, or I have to really slow it down, or I have to recover when I get to the top, using your exhale can be very, very helpful. So what you would do, and you could do pursed lip breathing, is you would stop at the bottom of a flight of stairs, take a breath in first, and then as you exhale, you would exert yourself. You would climb the stairs. So exhale just as long as you can step up as you're exhaling. So, and then when the exhale is done, you stop, recover, take a breath in, and then exhale, step. So, bodybuilders or weightlifters, they use that exhale to push heavy things, right? So I think of the exhales like the powerhouse of breathing because of the way the core stabilizes when you exhale. So you can think about that if you're lifting something up that's really heavy. Think about using your exhale to lift it up. Recovery positions. So like this woman over here, she has her hands on her knees. I think about kids do this like intuitively, like they're running around playing soccer and they stop to catch their breath, and they're using those accessory muscles to help catch their breath, to slow things down. We talked about pacing your breathing and that breathing zone chart that I showed you. So again, using your nose as like a training device. So the better you are at nose breathing, it does improve your endurance. But most of us want to skip it. They just want to go to our mouth because it feels better. But if you can pace yourself with your breathing, your endurance does improve. These are just some fun little sayings. So nose low and slow. Low being down in the diaphragm and slow. And then when in doubt, exhale out. So exhaling is always the best way to go because it's going to make space for your inhale. Okay, biochemistry. So I told you this is the really nerdy stuff. And if you were a respiratory therapist, you would probably be very familiar with this chart. But basically what this is saying is that carbon dioxide is actually beneficial. We don't want too much of it. Don't want to blow off too much. We want just the right amount because down at the cellular level, our carbon dioxide actually helps the oxygen leave the hemoglobin molecule to get into the tissue and the cell. So one example is if someone is hyperventilating, and I think about like when I was in grade school and someone was having an asthma attack, they might give someone a brown paper bag. They don't do that anymore because we realized that you don't get oxygen in a brown paper bag. But what they're trying to do is get that person to rebreathe their carbon dioxide because they're blowing it off too fast, right? So symptoms might be lightheadedness, tingling in your hands, your fingers, maybe passing out. So you do need a certain amount of carbon dioxide. And what can happen with exercise is that we just start breathing too fast. And some of us develop this pattern of this fast, shallow breathing, which isn't efficient at all. It's not going to get the molecules where they need to be, which is down lower in the lungs. So we'll do some exercises, but basically what I would want you to take away from this is that carbon dioxide is important. It does send the signal to the brain to breathe faster, and we do need a certain amount of it to get the oxygen into the tissues. Okay, so here's a breathing practice. It's called the 5 by 5s. And what this does is the hands will act like the brown paper bag. So regardless if you're having hyperventilation or maybe a panic attack, right? Because panic attacks can look like hyperventilation. Um, your hands kind of serve as a cup, right? So you would cup your hands over your nose and mouth. If you can breathe through your nose, great. If not, just breathe through your mouth. And you breathe softly in and out 5 times. And then you put your hands in your lap and then mentally just count up to 5. And then you repeat 1, 2, 3, 4, 5. And then hands in your lap 1, 2, 3, 4, 5. If you're someone who has a hard time wearing a mask, I know most of us aren't wearing masks anymore, but that's also another way to get your brain to adjust to having something on your face. But it can really help to slow your breathing down. So if you want to just try it, see what it feels like. I had one of my patients who had to walk up a hill to get to his horses, and it was the winter time. And he used this breathing, and he was like, it warmed the air for me. So I could, today's a great day. If you get outside and that cold air hits you, you can do that. It'll help to warm the air. So I like that one a lot, just to help slow the breathing down. And if you have any panic type symptoms going on. Another nerdy biochemistry thing is nitric oxide. So nitric oxide is a gas that your body produces, and what it does is it helps to relax the blood vessels in your heart and your lungs. So a relaxed blood vessel means that you get more oxygen into the blood. Nasal breathing produces nitric oxide. The more you mouth breathe, the more you're missing out on that nitric oxide. And nitric oxide is the part that is the antiviral and the antibacterial. It also helps to improve, just clearing of mucus, if you're someone who deals with that in your chest or your nose. So it's a pretty cool molecule. I could give a whole talk on nitric oxide. It's good stuff. And then we go into, I kind of touched on a lot of this, the psychophysiology of the breath, just how they both influence each other. This is just a picture of the autonomic nervous system, which sometimes it's called you have like two sides, you have fight or flight, or you have rest and digest. I think of the relaxation side as like the part of the body that is like when you can go into, I call it regrowth and repair, when the body heals itself. So we have to have time for both. Most of us go through life in sympathetic, and it's not a bad state to be in because we need it. That's how I drove my car here today. That's how I'm presenting to you. That's the part of my nervous system that is like go, go, go doing things. But we do need the other side, which is, when we go to sleep, we can go into parasympathetic or the rest and digest. When we do yoga, Tai Chi, even just like sitting down, closing your eyes and taking a rest break can help to trigger more of that sympathetic response. I'm not going to get too nerdy on this stuff, but I think you get the gist of it. So we want the breath to either respond from that fight or flight, like exercise, breathe fast, do all these performance or things we need to do. But then when we need it to relax, we want the breath to be able to relax as well. So just making that connection. This is just kind of repeating what I talked about. So if we're breathing fast in upper chest, that's sending signals to the brain that we need to prepare for something exciting or there's an emergency. Rapid shallow breathing, same thing. It's just not breathing very efficient. If you're anxious or stressed, it can also trigger that rapid breathing. And then a little bit harder to do, but sometimes I work with people one-on-one to help understand the breathing pattern with exercise. So ideally, we do want to try and get the air into as much of the lungs as we can. Okay, so a breathing exercise that can help to calm us down. One is, it's called square or box breathing. And this type of breathing I read that was developed by the Navy SEALs, because if you imagine if you're a Navy SEAL, you got to be able to stay calm in really stressful situations. They're probably diving underwater, holding their breath for a really long time. And so what we realize is that that ability to kind of hold and train the breath can actually stimulate more clarity and calm. So it's called boxer square because you there's four parts to our breath. There's the inhale, right? There's the part of breath that we can hold the inhale. Then there's the exhale, it's the third part. And then there's the part of the breath that we can suspend or hold the exhale. Most people don't like that part of the breath, right? So what it would look like is you would inhale, and the count can range from 2 to 20 or whatever, probably the Navy SEALs are holding their breath for like 20 seconds or more. But there's a little video I'll show you in just a second, but it would be basically inhale, 1, 2, 3, 4, hold, 1, 2, 3, 4, exhale, 1, 2, 3, 4, hold, 1, 2, 3, 4. So you can imagine that box as you're holding. I've had people use this. I had one lady, she just had to go to the emergency room, was all stressed out and couldn't calm herself down. It was more like an anxiety condition, and she was able to use this breathing technique just to help to slow her down so that she could kind of get through everything that was happening. So let me see if this link works. It's just a cute little video. Can you guys still see my screen of the happy face?
Yeah.
Okay. All right. So I like the visuals when I do this breath. And I think Rebecca will I'll share my PowerPoint with you if you like this as well. So we got time. So why don't I'm going to let this play. And if you want to try and coordinate your breathing to this square happy face.
Oh, wait. I don't see it now,
You don't
Julie.
see it. Okay. Let
Still the
me,
PowerPoint.
all right, let's see if I can change my screen. Okay, let's go to there. Okay. Now?
Yeah.
Yes, now we can.
Okay. Okay. Stop that and let's go back to
Ooh.
here. Okay. It's pretty powerful. And I also feel like it kind of gives your brain something to do. So not only are you getting the benefits of what's happening with your breath, but your brain is like it's paying attention, it's counting, it's coordinating, and it can really help get you out of some cycles of panic if that's a thing for you. And if it's not a thing, I still think it's a good practice, it's a good tool, to have in your toolbox just to kind of help manage breathing just in case, just in case. Okay, so I think this is our last breathing exercise, humming. And you guys will have to listen to me hum because I probably won't be able to hear you. But the benefits of humming are just incredible. Um, it stimulates something called your vagus nerve. So your vagus nerve kind of goes through different parts of your body, different organ systems like your heart and whatnot. But that vagus nerve is kind of like a messenger. So it can either send signals to your brain like prepare for an emergency, heart rate needs to go fast, you need to breathe faster, that fight or flight, or it can communicate the other end, which is like, okay, everything's okay. Let's just be calm. Let's relax. So humming stimulates that vagus nerve. It increases that nitric oxide that I talked about. It helps promote the diaphragm, the movement of the diaphragm. And as you'll see, it'll lengthen your exhale. So I'll show you two ways to do this, and I'm sure everybody has probably hummed before. but you would just breathe in. That's funny. This window popped up, just asked me if I'm playing music. It must be solid music. But yeah, that basic sound, right? And you can feel the vibrations. Another way that I was taught, and this is kind of yogic, but you would plug your ears and same kind of thing, but it becomes more of this internal experience because your ears are plugged, so you're feeling vibrations inside. So you can practice that, and we'll do it just for a few, like a minute or so, okay? Okay. So kind of silly, fun. If you have kids or grandkids, something you could do with them. But there really there's a lot of benefits to humming. And I will say, I work one-on-one with people who have either pulmonary conditions or what we call breathing pattern disorders. And this is one of the exercises that most people find very, very helpful, especially when breathing is elevated and you're trying to slow things down. Okay. So just some takeaways.
Second,
So
Julie.
considering,
Oops,
does
Sandy.
someone have a
Yeah,
comment?
unmute Sandy. There you go, Sandy.
Hi, sorry, I still don't know how to write the question, but would humming be a good thing to do when you're trying to go to sleep?
Yeah, I think so. Humming and then that diaphragmatic breathing will help to calm things down.
Okay,
The
thank you.
diaphragmatic one is coming into the belly, correct? Or
Yeah,
like trying to
yeah,
get the belly to move a little more than the chest.
yeah. And that's a great one to do laying down because I say you work with gravity because when you're sitting upright, everything is kind of pushing down. So it can be harder to get that belly to move. But when you lay down, everything opens up, like your chest, belly, and all of that. So a lot of people find that the diaphragmatic or like belly breathing is easier when you lay down. So yeah, you could do that before going to sleep. So yeah, just some kind of takeaways. So think about breathing through your nose, awareness of where you're breathing at rest, and just trying to, be more familiar. Like, am I an upper chest breather? Can I breathe down low into my belly? Even rib cage. So your rib cage should be moving to the sides, back and forth. Um, and then when it comes to exercise, again, try to breathe through your nose. Think about your body position with what you're doing. I'm a cyclist, so I think about this a lot because I might be hunched over on my bike. So in which case I'm thinking, can I get more air into the back of my lungs? Because right, we don't just breathe from the front, we also breathe on the back of the lungs. And then just finishing with those cute little saying, nose low and slow. When in doubt, exhale out. Um, there's my information. I'm going to stop sharing because I want to have some time if you guys have questions. Oh, I didn't pay attention to the chat.
There
Let's
you go. I got
see.
it. There was
Got
one
it.
question about what is 2 to 3 out of 10. So what's the 10? So I think just the scale goes up to 10.
Yeah.
Yeah.
Oh, you answered it. Yeah, you got it.
I've done a lot of different breathing exercises because I have a lot of trouble getting enough air in. And I do find the yoga, the Om, and the what's the other one? Yoga, both very helpful. And I also find the cow breath very helpful. When you go down like this and go, ah,
Okay. Yeah. Yeah.
and that one's very helpful too.
Lovely. Thank you for sharing that.
And
John,
I also,
go ahead.
what?
Go ahead, Susan. Sorry.
Okay, I'd just like to know if there's an app for that box breathing, because it's very nice to be able to look at that and really focus when you're doing that.
Yeah, I think that link I found was on YouTube. I don't use an app off the top of my head, but I would be almost 100% positive that there's an app for that.
Yeah,
I
that
would-
YouTube. Oh,
Yeah, we'll find one.
it looked like it was from Headspace. So I use Headspace.
Oh yeah, yeah.
And that
Oh,
same smiley
actually,
face was the same thing. So you can set like a breathing timer. So I don't know if that exactly was still there on Headspace, but that might work. But John had his hand up
I
before.
just wondered about the box breathing holding, whether it's just as effective to keep your airway open when you're holding or closing it off and squeezing, holding it like holding a breath. Does it make a difference if you just try to keep the airway, keep your lungs up and the airway open, but no air moving for the count of 4?
Yeah, so when you hold your breath on the inhale, it's going to help to just give your lungs more time for that air to kind of disperse in your lungs. And then when you hold your breath on the exhale, it's a little different. That's why most people find it challenging, because you're not full of air anymore. I mean, you always have air in your lungs, you never completely empty, but there's just something about the and then hold that can just be a little bit uncomfortable, but that's from the carbon dioxide levels. So once you get used to having a little bit more carbon dioxide, just temporarily, your body will adapt to that. So there's a whole nother science, and I'm going to go off on a tangent for a second, but around, like, you've heard of like altitude training, right? So people are intentionally stressing their bodies to do more at altitude, and people will even do that not at altitude, but use the breathing to stimulate that. So by getting desensitized to carbon dioxide, then you're able to perform under much higher stress without feeling it. So it's not totally relate to your question. Your question was more about the airways, but yes, like that breath hold can definitely help to open up the airways. Am I answering your question, John?
Yes, exactly.
Okay.
Yeah.
Okay.
Sandy.
Sandy.
Yes,
Hi.
Julia, could you spell that weird yoga name that you mentioned?
Yeah, it's Kaiut. Kaiut.
Kaiut. And if I Google that, I could maybe find some pictures or something of what you're talking about.
Yeah, I even have I have a YouTube channel, it's just Julia O'Shea. I have a video on there that's just a chair yoga, the Kaiut yoga, but it's in a chair. So, and I think it's only like 15-20 minutes. So you could check that out if you wanted.
Is that the
Um,
tune up? The tune up, the three. I'm trying to find it. I have the YouTube open. There's a Kaiut yoga tune up. The three girdles that you have. You're in a
it
chair.
might, yeah.
Okay, I'll try that.
I
I'll
think that's
put it
it.
in the chat here, Sandy.
Okay.
Yep. And then I know not everyone can come in person, but um, I can do it on Zoom. I have a couple people that do it on Zoom. I would just kind of guide you through what kind of props to have. And the tricky piece is sometimes you need to have space in your house. So if you can have space to put like a yoga mat and a chair and set up your camera angle, then I can teach you.
Yeah, I would like that. I've got everything I need for that.
And I put Julia's YouTube channel in the chat as well.
Okay, great.
Yeah, if you, I mean, there's tons of respiratory stuff on the YouTube. It's where I send the links out to the pulmonary rehab people.
Definitely can use all that.
Nice. Mhm. And yes,
This has truly been fantastic. Very good information. And it's not like over the years I haven't dealt with a lot of this, but just the way you've explained it and put it out there was really great.
Thank you, Susan.
Sandy, do you have another question?
Well, do I just open my search Google page and type in Julia's name in YouTube and then it will take me there?
Yeah, you can do it that way, or I think us, I'm sure Rebecca can send it out to you guys too.
Okay.
Do you see it in the chat there, Sandy, to click on it? Or is your chat not open? Okay. Okay. I can send an email. No problem. John.
Yeah, I was thinking just during our exercise classes,
telling the whole stadium how
I frequently forget to breathe. And this is mindfulness breathing is, I guess, something we can practice while we're in the middle of some strenuous exercises. I don't know if you could say something about how to keep the mind focused on that, on breathing.
Yeah, I like that you bring that up because when we're really focused on something, sometimes we just forget to breathe. Like I see that happen with balance exercises. Sometimes we just hold our breath. Even on our screens and our tablets and our phones, like there's such thing as screen apnea. Apnea meaning you stop breathing because you're just so focused, and then all of a sudden you're like, you take this big breath. You're like, was I just not breathing or something? So that's why I really like the pursed lip breathing because it does kind of send that signal to the brain like, okay, breathe in through my nose, blow out through pursed lips. And it's not that you're going to do that the whole time you're exercising, but the more you practice it and even bringing that breath awareness at rest, then it'll transfer into activity.
Thank you.
Anybody else? Well, thank you, Julia, so much for your time.
You're welcome.
Even
My
the nerdy
pleasure.
stuff. I love it. That we need the CO2. I was like, huh. 'Cause I didn't realize the exchange of it. I thought you just exhale to get it out of there. So
Yeah.
yeah, thanks so much. And this will
You're
be on
welcome.
our YouTube channel. And thanks everyone for joining us. Next Friday we have Amy Miller here, who's also in the desk behind Julia. Actually, she does a chronic pain program and a physical therapist at our clinic, and she'll be talking about pain. All right. So same channel,
Everyone, have a
same
good
time.
day.
Thank you,
See you
Julia.
next time.
You're welcome.
Thank you, Julia.
Bye.
Take care.
Thank you, Rebecca.
Bye.